Okay, a brief overview. Now, the reason I'm giving this brief overview, which you can see actually download the text below, is because there's a lot of details in family purity, and here and there people get things a little bit confused, a little bit, there's just a lot to remember. So that's why I wrote the brief overview below, and that's why we'll just give a very rough sketch here. The purity cycle, as far as Hilchos Nida goes, is pretty much this. The beginning of the cycle is usually considered when menstruation begins. Now, menstruation beginning refers to blood which comes from the uterus. The cervix is already a question, but let's just keep it simple for the purpose of this overview. When blood exits the uterus or the womb, we use that in my book interchangeably. At that point, the Nida state starts. Now, it doesn't matter how much blood exited; it doesn't even have to actually leave the body. As the moment that it leaves the womb or the uterus, the Nida state has begun. Sometimes this can be induced. It could be, let's say, some sort of. It doesn't always have to be because of the monthly cycle. It could be also because of some sort of medication she's on, which causes that. It could be breakthrough bleeding in pregnancy, but that's just the general way that Nida begins. At that point, the couple needs to wait at least 5 days. They wait 5 days. The custom of Moroccans or some Sephardic customs communities is to wait 4 days, but Ashkenazim and Chabad definitely wait at least 5 days. When bleeding has ceased, all bleeding, at that point she's permitted to perform a hefsek tahara, means it's an internal exam. The body is washed thoroughly, if possible. If it's not possible, there's different scenarios where washing the entire body is not possible and it's still okay. The private area itself is washed. And then an internal exam is performed with a clean, white, soft cloth. And if that's done prior to sunset, and it's close to sunset, prior to sunset, there's a lot of details. Sometimes the wife might be traveling. Sometimes she might not be able to do it at that time. So there's different ways that it might be done earlier, but for this purpose, we'll just consider it close to sunset. And before sunset. At that point, the custom is, if that's clean, spotless, then another cloth is inserted before sunset, which is another white, clean, soft cloth, and that's taken out after starlight. And if that's clean, she begins the 7 white days. During the 7 white days, she immediately starts wearing white underwear, white sheets on her beds, and for 7 days, she checks twice a day. Now, there's a lot of details here. If she doesn't have underwear, if she's traveling, if this doesn't have white sheets to her bed, we're not going to get into those details right now. She passes through the 7 white days, and again, she's checking twice a day. If she has difficulties, or she's after birth, or she has some injury down there, or if there's other circumstances, call her Rav, or write to me, call me, whatever is comfortable for you. At that point, she finishes the 7 white days. At that day, she prepares her body and her hair. That's called in Hebrew the chafifa, which means preparing. That day, she washes her entire body, paying close attention to the fingernails, to the toenails, to the ears, to the nose, cleaning the teeth. There should be nothing stuck between the teeth. That day she doesn't eat meat on that 7th day, unless it's Shabbos. Okay, she usually does that towards the end of the day, around sunset time, and it's best if she can continue until the nighttime, which kind of like bridges that gap of time. That night, the night following the 7th day, is the mikveh night. She goes to the mikveh. In the mikveh, there's other preparations that she repeats a little bit, combing the hair, combing the hair, cleaning the teeth, make sure. There's another, and in both, in the afternoon and also in the mikveh, part of it is to visually look at every part of the body which she can, and feeling the parts which she can't see. And the idea behind the preparation is that we don't want anything separating her, any substance on the body which could separate between her and the mikveh water. So the idea is, let's say if there was, I don't know, maybe there was a Band-Aid, which is unusual, or some other thing on the body, we want to make sure that's not there. Water doesn't have to come into her mouth. She doesn't have to open her mouth, but we need the mouth to be clean, so there should be nothing stuck between the teeth, even though her mouth is closed when she immerses. And then that night, she goes to the mikveh. She immerses in the mikveh. Most mikvehs nowadays, it's best to go to a real professional mikveh. Sometimes women are in situations where they have to go to a river, or they have to go to a lake. It's a little more complicated. It's not so easy. You need more supervision. You need to know a few things. We won't get into that here. At the mikveh, there's a mikveh lady. She's usually very sensitive. Very open to your needs. Any questions, you ask her. She gives you a visual, looks through to make sure that all the preparations were done properly, and then the woman immerses. The woman immerses usually once, and then she raises her head. She says the blessing, and then she usually immerses again. People have different customs, etc. There's different ways that's done. And then when she leaves the mikveh lady usually touches her or says, "You're kosher," and that's pretty much the purity process, purity cycle. And then from there, relations become permissible again, and then they have to calculate for next month when the next menstrual cycle might begin, and we have another video on that elsewhere on this site. If you ever have any questions, write to me or call me. All calls and all mails are always anonymous. And that's it. That's the overview in a nutshell.